I want to make some comments about the testimonials regarding intravenous NAD therapy for drug rehab or getting off drugs and pharmaceuticals. And probably you're aware that you're seeing only the positive testimonials, which there are definitely positive results from IV NAD. But it's also important to know that, there's a lot of variety of people's experiences, and most of the testimonials that I viewed have been after the person has just completed the typical 10 IVs. And of course, no videos would be done about people that are not responding, have not done well on the intravenous NAD. So there are failures. I'm a physician that's been doing or providing NAD for about 8 years now. And I would say that probably that part of the program often that's offered is boosters. Boosters being another IV NAD for those people that are starting to feel symptoms again. Their symptoms are reoccurring again. So these boosters are provided. The question is, why would boosters be needed if the 10 days of IV NAD was effective? So the question is, why are there failures? And I've realized this. We thought that NAD was the miracle cure for drug addictions, which I think is miraculous, the benefits. But if you're doing just the IV NADs, there's some shortcomings which I want to address. Most of the issue with addictions or drugs is the result, or the side effects resulting from mitochondrial dysfunction, because these drugs enter cells, the residues are left behind, and the person begins to feel or experience side effects because of mitochondrial dysfunction. But there's a lot of other issues going on with people. When people say, I'm having side effects from medication, I want to get off, people in general have a lot of other issues going on besides just the side effects from drugs. Symptoms, physical and mental symptoms, are due to many different things, different causes. So NAD is great for drug addictions, helping the body, helping cells to detoxify from the residues from these drugs. But people are not well for a lot of other reasons. And all the programs I've seen out there are not addressing these other causes. And therefore, there is going to be relapse. So it is miraculous, but it is not the miracle cure unless you provide a holistic approach that is assessing and addressing a lot of other different causes. And these causes, to name a few, can be nutritional deficiencies. The cells are not getting the nutrients they require to function optimally. And this can be due to poor choices for nutrition, incomplete digestion of food, poor assimilation of nutrients into the body. People also, I've been practicing medicine for about 34 years, and I know a lot of people that I've seen using a dark field microscope have bacteria, viruses, and mold in their blood. And these all excrete biotoxins or their waste products. These residues get inside of cells and also cause the same issue, which is mitochondrial dysfunction. There's also small intestinal issues, bacterial overgrowth, candida, parasites. There's hormonal imbalances, estrogens, progesterone, testosterone, cortisol. These are all underlying issues, especially after being on these medications or drugs. People's guts are not working, their digestion's poor, they've got other residues inside of their cells. There's also dental issues. A lot of people have root canal problems, cavitations. So there's many other reasons for people becoming ill. And these other reasons NAD is not addressing. So again, I truly believe that any clinic offering IV NAD must be in their own conscience determining other underlying issues and removing them or addressing them. So if you'd like more information on our holistic program, you can visit our website. It is ivnaddrugaddictions.com. If you go to that site, you'll find a free download of my ebook, 60-page ebook. And we hope that you will contact us if you have any other questions. And I thank you.